It's the same time of year again where the kiddos are picking up every illness in the world, it seems, and they pass it to all of their loved ones, especially mommy and dada. And sometimes, of course, others as well. So this afternoon we have Dr. Kehinde Obeto from the Toledo Nationwide Children's Hospital talking about more of what is going on. Doctor, thank you so much for joining us.
Of course.
I'm just going to be real specific and talk about my little germ, Petri dish child. When it comes to symptoms of flu, RSV, how do I prevent her apart from wrapping her in a bubble and never letting her outside? What are other ways to keep kiddos safe?
Well, the main way to keep them safe is to make sure they practice good hand hygiene. Hand wash, hand wash, hand wash. That's the most important thing. You also need to teach kids that when they want to sneeze, they need to sneeze either into a tissue or into their elbows.
So not in my face.
Not in your face. Because, because once they do that, if they sneeze into your face, then you can easily get contaminated with the germ. Or if they sneeze onto this table, and then you come later and touch the table and then touch your face, then you get it. So if you try not to touch your face as well, and try to wash your hands before, like after touching stuff, that actually helps to decrease infection.
Put my hands at my sides. Don't touch my face. Don't touch my, and she can't touch my face. And wash my hands. Okay.
Yep.
So those are the two things. Also, when it comes to now, okay, I couldn't avoid it. She coughed, and here we are. And now we have an illness. When should I go to the doctor versus when can I treat it at home? Are there specific signs that say, hey, you need to get to the doctor or you need to get to the hospital versus just, this is kind of, it runs its course, excuse me.
So, well, most times with kids, we say most viruses run its course, but with things like RSV and flu, sometimes it gets really bad with some kids where they have trouble breathing. You see them struggling, they're like, or they're wheezing, or they have, sometimes when they cough a lot and they're having respiratory distress, then they're not really drinking, so they get dehydrated.
Okay.
So when their urine intake decreases, or when they start having trouble breathing, when you see them struggling to breathe, then it's time to go to the hospital.
Fevers, because of course that's always the thing. So belabored breathing, obviously, when it comes to not taking in more hydration, but when it comes to fevers, is there, so automatically at 100, I'm panicking and I'm running to the hospital, but I know I probably should kind of wait that one out. What do I do?
So usually we say we don't consider it a fever unless it's 100.4 or over.
Oh.
Is what is considered a fever. Most times with low-grade fevers, it's actually the body's way of fighting off the virus. So we say let it be. Most times with my patients, I tell them we're not treating the fever, we're actually treating what is causing the fever. So even if your little one has a fever, I say wait, and he's doing okay, wait at least 3 to 4 days. Okay. And then if it hasn't gone away, then it might be time to go into the doctor just to make sure he doesn't have like a pneumonia or an ear infection or something else going on. Even if you do go into the doctor and they say, oh, he's fine, he doesn't have a pneumonia or an ear infection, then you're gonna have to wait its course.
Okay, but as we know, little people, just like older people, but maybe they can't communicate, they're cranky, they're uncomfortable. So I take you to the doctor and then you fix her. Okay, fine. What are some ways we can stay, what are other ways we can, are there certain vitamins, are there certain medicines? Again, what do I do? What do I give the child, you say?
Well, I just say eat right, drink lots of fluids, that will help. Sometimes if they're really congested, having a cool mist humidifier in the room where they sleep actually helps with that as well. And then in terms of the little babies, like a lot of the time, RSV is like a leading cause of respiratory distress around this time of the year. So they now have the new monoclonal antibody that you could give babies 0 to 8 months of age that could help prevent RSV.
Okay, well then there's that. And then of course, are there any other things? So you've got that. I know I specifically for my kiddo, Synagis was something that we took. So obviously shots. Is there, I don't know, cough medicines? I know we've been having a lot of conversations in medical circles about what cough medicines do and don't work. Are there something for you would say?
Well, I and the AAP, we don't recommend any cough medication in kids less than 4.
Okay.
Because we don't feel it works. So the side effects of the cough medication are actually worse than what it actually does. Oh. So we say stay away from cough medications. Just treat them symptomatically. If they have a fever, give them Tylenol. If they are dehydrated, give them fluids. Just try to keep them drinking and try to keep their, like the cool mist in the humidifier to kind of help the mucus keep draining.
I saw, because of course, my age, TikTok, TikTok, doctor.
yeah.
So can I sticker? I was told that being in bathtubs actually helps. Does that help or does that hurt sometimes?
So sometimes if you run hot water, the steam might help loosen up the mucus.
Okay.
Yes. So that's the way it helps. It helps loosen up the mucus so he doesn't sound as congested.
Okay.
That's the way that works.
Okay, so no cough medicine because it's not gonna work. Go ahead and be healthy. Wash your hands. Don't let the child cough directly into your face. Best of luck with that one. Is there anything else you want to make sure that we talk about? Because again, it feels like we said, when the cool time comes, everybody gets sick. Is there anything else you definitely want to make sure we do?
No, the only other thing is the flu vaccine. Kids 6 months and over can get the flu vaccine, so that could help a great deal too to prevent the flu and spreading it around.
I will say, even in my own specific family, there are people who say it doesn't work, there's no point, and all you do is you end up getting the flu. As a doctor, as a medical professional with 20 plus years of experience, why is it important to get the flu vaccine?
Because it prevents you from getting sick, it prevents other people from getting sick, and I say trust the science. It works, it's true. The flu vaccine helps prevent you from getting the flu.
She said it, not me. I'm just saying.
Ooh.
Doctor, thank you so much, and I support it, and we will be right back.